Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. Today's topic is continuous birth control pills. So, if you're on birth control pills, you might have heard of taking them continuously, and there are some values for that. So basically, the normal birth control pill has some estrogen and progesterone. There are exceptions, and there's usually some fake pills at the end, either 7 days or 4 days. And during that time, there's no hormones. That gives you what's called the withdrawal bleed. So that's usually when your period comes. There are, however, some advantages to taking your birth control pills continuously. And what that means is always on the same pill with no break, no 7 days or 4 day break. You just take the same pill every day. It usually works better with what's called monophasic pills, the same dose every day. There are other pills that are called triphasics that have 3 different doses, and usually doesn't work as well to use those continuously. So what are the reasons to be continuously? Well, one is you can potentially get rid of your period. Now, some women find that a great idea and a very attractive idea, and others feel that it's not natural and would rather have the period. For example, easier to know you're not pregnant if you have the period. But if you have lots of discomfort and hassle from having a period, then taking it continuously can potentially vastly decrease or eliminate your period. Now, for some women, it works well for a few months, and then you start having some spotting. Some women don't have it for years. Others spot every few months, and that has actually prompted some 3-month birth control pills. The brand name, they're not generic, has been Seasonal, Seasonique, Low Seasonique. There are others. And basically the concept is 3 months of pills, 1 week off to give you a period to avoid some of the irregularity. But you could do that with the other pills. Again, this is general information. Speak to your practitioner for your particular case. It may not be appropriate for you. They may tweak things, but now you're getting some of the background, so you're able to ask the question. So if you're taking it continuously and you start having some spotting and it continues, what we often recommend is to stop for 4 days, let yourself have a period, and then restart. As long as you're only doing that once a month and not twice a month or more, then your pill is still effective, okay? But again, get your specific answers from your provider. What other reason would you want to do it? Well, some women have significant PMS, premenstrual syndrome, mood swings before their period, change in their thinking ability, their focus, their concentration, their mood, and that can be potentially improved with a continuous birth control pill. And the choice of pill, some are better than others. That's something you should address with your physician. Others seem to have headaches around their period time. Now, headaches are tricky, especially migraines. There is the potential for improvement of your headaches, or there's a potential for making them worse, and you need to be cautious, especially with migraines, especially if you have an aura with migraines and you have some visual changes, especially loss of vision in one side. In that case, you shouldn't be on any birth control pills. So before addressing headaches and your periods, make sure you discuss it with your physician, but there may be the opportunity to vastly reduce your headaches or even eliminate them if you're on continuous birth control pills. So it's worth a discussion with your provider. Think about doing that. Also, sometimes doing it continuous can time your period for weddings, avoiding your period during a wedding or some other event. If you want to do something like that, what I recommend for you is get to your physician, but give them forewarning. If you ask them 3 weeks before, there's nothing they can do. If you ask them 3 months before, or even preferably 6 months before, there's a lot we can do to help time your period so that it doesn't ruin your wedding, your honeymoon, or whatever special event you have. I hope you've gotten some benefit from this description, and please leave your comments. Take the time, talk to your provider if you think this is of value to you. Thank you.